Hello, today we are talking about cording and scar tissue. So our patient here today had a sentinel node biopsy, and then after she had a axillary dissection, and they took out how many nodes?
11.
11 nodes. And so if you look here, right in her axilla, her armpit, there is a scar. It's been 3 years.
3 years.
3 years, and so it's healed. There's no redness, swelling, infection. It's nice and healed. However, if you can see here, we have adhesions. There is scar tissue that is holding that skin down. And when I pull that apart here, you can see even more. So two things, we have the scar tissue, and sometimes the scar tissue will cause some cording in your axilla, and it comes in different looks and sizes, and sometimes it's a little stringy rope, and sometimes it's a big thick cord, which is what we're dealing with here. So the way I treat this, and I teach my patients to treat, first we look and attack the scar, and we do a cross friction massage. We go perpendicular to the scar, and we give firm pressure back and forth along the length of the scar. Okay. The second thing you can do, and we do this when the scar is healed. We don't do this when you have, you're fresh out of surgery. You can do this when the scar is healed. The second thing I do to help with the scar is I use these cups, okay? So I'm giving the push to help break up the scar tissue. I use a little bit of cream. And if you see here, I go ahead. Now here, I'm not on the scar, and you can see how the cup pulls up the skin and it moves as it should. But as we come and work our way over to the scar, and if you could see Miss C's face, you could see that she's not liking this.
No, but it's working. So
so I'm going to take off the cup for a minute, and I'm going to get more into where I need to be, and I'm going to use my hand to stretch the area. Actually, when I stretch right there, you can see a little tiny cord right in there. Right there, it's popping through. It's very difficult to see. And I'm going to go ahead and pull, and this cup wants to kind of push me off the area I should be. But you could see how the damaged tissue does not pop into this cup as it should, as it does with normal tissue. Okay. And what I do is I do like a pull-through technique. I don't want to leave the welts on my patient. We're not Olympian swimmers like Michael Phelps to have all those welts after his cupping sessions. You're going to go over the scar and pull through, and it's also more comfortable for the patients. Okay, so you're going to cup and try to pull through over that scar. Okay. And then I'll teach my patients how to find that area and cup on their own. Okay, stay tuned for more.